And this afternoon, Dr. Michael Daignult talked to us about the latest surge.
He's an ER doctor at Providence St Medical Center. He showed us how Omicron and Delta are both playing a role.
As far as testing goes, a lot of us are used to getting the nose swab, but now we're hearing more so about people getting the throat swab. What's the difference between the two, and what should people be looking at?
So this started off anecdotally, and then we've had subsequent smaller studies that continue to come out that show that if you add a throat swab to your traditional nose swab for a rapid antigen test, it increases the sensitivity, increases the accuracy of detecting Omicron. So what I recommend people do is take that swab the very back of your throat for 10 seconds, take the same swab, and then go around each nostril 5 times, and then process the swab with your testing kit as directed. And I think that will increase the sensitivity and the accuracy of this test and detect more of the Omicron infection than just swabbing the nose alone.
Yeah, talking about case counts here in LA County, for example, our numbers are through the roof. They keep rising and rising. When do you think we're going to hit peak? And when do you think, or what effect do you think this will actually have on the hospitals?
Sure. So, Chris, as you saw yesterday, we set that record with 27,000 new cases in LA, and that's absolutely an undercount given the amount of home rapid tests and other tests that people are doing on their own that don't have a reporting mechanism to public health. And so, 27,000 definitely an undercount. I expect that we're going to see even higher numbers in the coming weeks. Again, looking at the UK and South Africa, again, it's difficult to compare across countries, but I think what we can expect is we're going to have a peak in about 2 weeks. So about mid-January, we hopefully will see a peak in cases, and then we'll see just as rapid a decline. But that means the rest of January is going to be rough. We're going to see a lot of cases, and I think certainly Delta is actually driving a lot of the hospitalizations. I mean, as Dr. Ferrer mentioned yesterday, Omicron has not completely displaced Delta here in LA. There's still a lot of circulating Delta here. We plateaued at a high level of Delta before Omicron hit. And, based on what we're seeing from lab tests and then in clinical data, that Omicron does cause less severe illness. So my feeling is that the reason we're seeing increased hospitalizations is due to Delta. So you have Omicron driving those high number of cases, and at the same time, you have Delta causing the severe illness that's landing people in the hospital.
And Dr. Daignult says if you do test positive, let symptoms be your guide. If you have symptoms, you're probably still contagious, but if they go away after 5 days and you have a negative test, you can end isolation. Be sure to stay with KCAL 9 News. Also, CBSN Los Angeles for continuing coverage of this pandemic. You can get updates anytime at kcal9.com.